Hey guys, Dr. Taylor, nurse practitioner here. I am so excited to talk to you all today about kind of this new evolutionary thing that we're doing with PRP and PRF. So what we're now utilizing is heat to break down the albumin and create almost like a gel-like substance, as well as the PRP and the PRF, which is platelet-rich fibrin, to create growth factors that we can put back in the face. So you will be seeing throughout this video how it works, kind of the process of it. But I wanted to chime in and say, who would be a good candidate for this, as well as why I'm so excited that this is something that we can utilize. Really, I think this is great for anyone who wants very natural volume, who's maybe not ready for dermal fillers, or even in combination with dermal fillers, if we're trying to, fix a bigger problem like both, loss of volume in the cheeks and mid-face, as well as teardrops. I might do a combination treatment with the gel, the PRF or PRP gel, and dermal filler. So it's really cool. I'm super excited. Not only can it give very nice natural volume, but it can almost illuminize the skin, kind of like when you get the sculpture glow, you kind of get this EZgel or Derma glow, which is amazing. So not only is it helping volumize, but also gives you that people can't pinpoint it glow. I actually have both systems, both the Cellenis Derma, which utilizes PPP, which is platelet poor plasma, and PRP, which is platelet-rich plasma, as well as EZgel, which is still the albumin, but instead of the PRP, it's platelet-rich fibrin. So just a little bit different protein that we're utilizing to stimulate growth factors in the skin. Both are great. I'm still kind of playing to see which one I prefer, but yeah. So basically what it does, I already kind of talked about we spin the blood down, we take the product, spin it down, create an albumin, which then we extract, and we heat that portion up to a certain degree to where we're not breaking down those proteins, but what's happening is we are breaking down the hydrogen bonds within the protein molecules, and then we are structuring them into a more dense, organized mesh-like scaffolding. And by doing this, it actually extends the reabsorption properties for 4 to 6 months. The ideal treatment would be you would do 2 treatments spaced about 6 to 8 weeks apart, and then you would ideally get this done roughly every 6 to 8 months. I'm still playing with it, so I'll give you my true honest opinion as far as like longevity goes as I continue to utilize this. But it is, like I said, a great option because it's great pricing. So I know everywhere is kind of different, but you do get quite a lot of product, which you can use not only in the face, but you can do neck, décolleté, backs of hands, kind of sky's the limit. You could do buttocks if you really wanted to. So I'm just super stoked. Let's talk about process of creating it. So like I said, we draw the blood, we spin it down, we heat up the albumin, we cool the PRF so we're not causing it to clot off. And then what we do is once everything's cooled and at room temperature, we can mix it all together, and then it's ready to be injected back into the face. So as you can see here, we are focusing on her neck, décolleté, and back of hands, which I will show you that injection here shortly. And I would say it's really great for when we are utilizing other modalities like lasers, maybe mixed with Radiesse, which is a collagen stimulant when you're hyperdiluting it down, just to increase collagen, help with those fine lines, help with that elasticity. As far as downtime goes and pain-wise, it's actually a pretty comfortable procedure. I do like to use a cannula, however you could use needle as well. I like to go into different planes. So I like to place some deeper as well as a little bit more superficial, so I'm treating all areas of the dermis, and even down on bone for mid-face if we needed to. And for back of hands though, you do want to stay a little bit more superficial, so we have a decreased risk of really getting into any vessels and causing bruising. But downtime wise, you will have maybe a little bit of warmth afterwards. You don't want to put ice on it because we want those inflammatory properties to be happening. Like, that's where the magic is going to work. So we actually want to let that inflammatory cascade happen, as well as a little bit of warmth, swelling. There's always a potential for bruising. But of all the things I do, I would say the downtime is very, very minimal. The discomfort is maybe for that day of injection, and then, a little bit of prolonged bruising. But yeah, I mean, it comes with the territory of getting poked. And then, so you go home, you can pretty much go about your normal routine. I will say every time you stay hydrated, it always can help anything you do. But you can sleep as you normally would, wash your face as you normally would. I would avoid strenuous exercise for about 24 or 48 hours, just like with any sort of injectables. And then I would avoid any sort of like heat procedure, like RF microneedling, or even like a CO2 for about 4 weeks at least. But yeah, all right, peace out.